Hello, you've got Ted Corliss with the Corliss Barfield Trial Group. My name is Ted Corliss. I am a property insurance lawyer based out of Tampa, Florida, but my office serves the interests of policyholders all across the United States. Over these past several weeks, we have been dedicating much of our resources towards assisting people in the Tampa Bay community who have been suffering as a consequence of the COVID-19 pandemic. Now, what is it that I could possibly bring to that? A couple of things. The first is that we started a program called Mask Mission. That's hashtag Mask Mission because hashtag Corliss Cares. That's me, Ted Corliss. The idea is that throughout the entire community where my law firm is based in Tampa, we encountered older people, people working with the public, and otherwise vulnerable to catching the COVID-19 who are without personal protection equipment. But before we get to the personal protection equipment, I want to address some of the medical issues that have been coming up in the standard news circles. I have to tell you that I've spent the last 25 years taking depositions of every brand of expert that's ever existed. Anything from architects to engineers to surgeons, regular doctors, financial people, management people, just about any kind of specialty that you could ever hire. But what we've discovered is that currently there are a lot of individuals who are proposing various public health ideas that are not necessarily based in sound science. And so the more I saw or heard people misrepresenting the nature of the virus itself, either to benefit themselves or simply because of the hysterics that they enjoy associated with that, what I've tried to do is to reach out and to provide counsel as well as resources for people in need. And so over these past several weeks, we have been donating personal protection equipment. But along the way, I've certainly found a need for a qualified physician to answer some of the most basic questions that we have about this. For example, today is the first part of June, but most of our children, my daughter included, will be going back to school now sometime in August. Is it safe to do that? What is the nature of the research that has been done to date to identify some of the more common factors that are leading to fatalities when people do get COVID-19? Or perhaps allow individuals to go longer periods of time with the disease than, say, otherwise. And so what I like to do is, in that context, I want to reach out to an individual that I personally respect and someone whose opinion I've based my own personal medical opinions on. And that's my doctor. And so in just a few moments, we're going to begin playing for you an interview that I took of him yesterday. Very much appreciate his time and his counsel. My doctor's name is Dr. Radley Griffin, and Dr. Griffin is a family health physician, board certified in family medicine, and has been for more than a dozen years. And I have been one of his patients, regular patient now, going on 8 years. He has provided enormous counsel to me personally. He also helped serve one of my family members who had a very severe medical condition a few years ago, and he really stepped up his game and gave us the support and the direction that we needed to get her out of those circumstances. And so what I'm going to do in a few moments is, when we play this, I'm going to ask him some of the more interesting questions that I found about COVID-19. For example, are there certain people who are especially vulnerable to this? He also, at the end, will give us some counsel regarding some specific things that we can do for ourselves while this pandemic is moving forward so that we can protect ourselves against injury and potentially our own mortality. And I give you now Dr. Radley Griffin. Dr. Griffin, thank you so much for speaking with me today. How are you today in that sweltering heat in Colorado? I'm sorry, you're in Florida. I'm in Colorado. How's it going down there?
Hey, thank you, Ted. It's great to talk to you as well. It's very sweltering here in Tampa, Florida, but I think a lot of people are enjoying getting out into the sunshine no matter the heat to get a little bit of that vitamin D, which is so important these days. So yeah, it's good to be here. Thanks for having me.
Okay. Well, that's such a great thing to start on. And I just wanted to tell you that full disclosure to those that are listening, Dr. Griffin happens to be my doctor, and a damn fine one at that. And I had an opportunity to speak with him the other day, and afterwards I felt that so many of the things you shared with me, others would benefit from hearing. And so I'm glad you hopped on a call with me. Let's begin by just asking a generic question about COVID-19. When do you believe that it showed up in the United States for the first time?
Well, I think the first presumed case was out in Seattle, I believe, discovered around the 20-something of January with a person coming from Wuhan, I believe. And that patient was hospitalized and successfully treated with remdesivir. And that was really the first known case. And then, of course, in my practice, a lot of patients have said, gosh, I thought I had something like that in December. I think I had something like that in February. And, so there's a lot of that. So the antibody testing for COVID has been really interesting. And this is basically a blood test that we do. We draw in the office, we send it to the lab, and it can tell us if a person has ever been exposed to COVID, SARS-CoV-2, which creates the disease COVID-19. And these tests are specific. We think they're very specific to COVID-19. And so what we do then is we say if some of our tests, I think we checked about 500 to 600 between 500 and 600 of our own patients in our practice, which is a solid sampling.
That's a big sampling, sure.
And we found around anywhere between 3 and 5%. And I say it's not as, because I haven't calculated it recently. And we used two tests, and one test actually gave an antibody level. And we know that some of our patients who tested positive, who had COVID-19, we tested them with nostril swabs. They tested positive and recovered. And then we subsequently tested them for antibodies. Some of them actually came back with a very low-level antibody. And had we not known that they actually fought off the disease, their antibody would have been read as negative. And in fact, we know that about 40% of our positive cases have so far tested negative for antibodies, which is something we can maybe touch on a little bit. But through all this testing, all of our positive cases, what we would do is we would circle back with them and say, hey, you tested positive for antibodies. When do you think you had maybe some symptoms similar to, that could have resembled COVID, where it be a cough, a fever, feeling run down, fatigued, headache? And we had a couple of cases coming in and this is Tampa folks. And so we had a couple of cases saying, it was back in February. We had a bunch of the March time period. And we even had one patient who said, back in December, I was really knocked down.
Right.
And so, and we know, so it would not surprise me, especially knowing that we read that there was a patient in France who was tested posthumously and tested positive, and that patient, I believe, was a female, passed away in December. And so, just based on that anecdote, I don't have any proof. Is my patient obviously came across COVID and had symptoms in December, so I could guess around December just based on my personal relationships there.
Well, I guess the significance of it being that far back into the past is that I think you had mentioned to me the other day, you actually believe that we're in the middle of the bounce right now, as opposed to a bounce coming in the end of this year. Is that right?
That would make sense to me, because from that perspective, because if we know that this virus is spread pretty easily, and we can see that there is a pretty decent infectious rate, maybe a little bit greater than flu, and we see that from the different ships and the prison systems, that it's if it's in these close quarters, the virus can spread pretty easily.
Right.
And so we say it's we figure it's a very infectious type pathogen. And so a lot of, I'm not a virologist by any means, but just learning more and more about it over the past several months, most viruses follow a sort of a two-hump pattern, an initial hump and then a pretty enormous second hump. And gosh, if, looking back at this past enormous hump that we experienced here in the U.S., and then when these known cases, so if we figured that the first hump was happening in the, undetected in November, December, probably some deaths happening, but we just figured it was, we actually had one of our patients pass away in December. No, actually it was early January, and it was one of those things where we were talking on a Saturday and they passed away on Monday. It's like, whoa, what the heck was that?
Wow.
And so
Wow.
we don't think that was COVID, but we were just saying, gosh, yeah, these things happen. And we were really none the wiser because we felt like COVID wasn't over in the U.S. just yet because we knew China was battling COVID there and felt like it was just discovered. So one theory is that it was that initial, if this virus is spreading pretty easily, you get a pretty good first hump, and then you get a pretty massive second hump. And the theory is that we're coming to the tail end of that second wave. And that's my prayer. Gosh, if we have to go through a bigger second hump in the fall, God help us.
Well, I know that we've all seen the video of the Lake of the Ozarks where there are people literally shoulder to shoulder to each other. How do you think that particular event will be relevant to us understanding this disease?
Well, I think we look at that and I think there's a lot of theories right now that, gosh, we needed to lock down and then different measures that we're taking that are somewhat foreign to those of us here in the U.S. I mean, I think on a good day, a lot of us might wash our hands. so getting a little bit better at that was a really smart idea. But then some of the others, I think it's, the ideas of infection control, I think are important for us to take a look at, and really gleaning from what's happened to us, what is effective and what isn't effective, really for the long term. And so one theory is that, what is the genesis of the 6-foot rule? All of these folks in the Ozarks are outside. They're not adhering to any smart distancing or social distancing, and it can create a degree of outrage. But I think what we can learn from this is truly, okay, this virus be spread and, in certain temperatures and with certain UV penetrance? Can it be spread outdoors in active sunlight, especially when we're getting toward the summer where we get more UVB penetrance into the outdoors, especially as the angle of the earth shifts, the UV increases going northward. Whereas I think it's around Birmingham, Alabama latitude and below that gets really good UV all the time, and anything above that, basically from November to February-ish, gets very poor UV. Right. And so what we see there is that we're now beyond that period of time. There's good UV happening. People are outdoors. And I think Florida experienced something like that in March with spring break. And, the infamous Floridian kids are saying, I don't care about COVID, I got a party, well, and we're all
welcome to Florida.
We're all collectively groaning here because we're not knowing how the heck this thing is spreading and really not knowing a whole lot about the virus at that period of time. And we didn't see that big spike. Of course, there were some kids that came back from spring break, even here in Tampa, and there was a group of 4 college students who all tested positive. but we just didn't see that exponential spread, here in Florida. And I will say, Florida, we locked down late. I think we locked down in early April. And our office is right on a busy street here in Tampa, and it was quiet for a bit, but for the most part, people were out and about. It was not, I would never classify Tampa as ever being a ghost town, as a lot of my patients who live in other cities, San Francisco and even New York, where it's just eerily quiet. Tampa was never really like that. And so I would say if there was a way to do it right, we weren't doing that. If social distance, and we weren't completely frivolous, but weren't, I think businesses were trying to keep patrons 6 feet apart, really doing the best they could. And occasionally we'll have.
Right. And so much of our, Florida's economy is based upon those kinds of things. It's based upon people being outside, sitting in tiki bars.
Correct.
Or, and, you mentioned UV light. I guess one of the things that's important there is, so UV light actually kills the virus, as well as UV light would give you higher concentrations of vitamin D. Is that right?
That is absolutely correct. And so, and just to finish up on the Ozark crowd. So I think we'll find out, which is the simple answer. My hunch is that we will not see a spike, and I think we should take comfort in that. And I think we can learn. As opposed to being outraged by a particular crowd and saying, "What the heck are you doing?" I'm kind of looking back and saying, I wonder how this is going to play out.
Right. Well, they're making themselves more kind of lab rats, but
sure.
I
sure.
Well, and again, I think it's that idea that if you're 25 years old and you're out hanging out with your friends, because truthfully, there really aren't that many 25-year-olds that are dropping dead from this, are there?
No, there's not. It's really, I don't have the data in front of me, but we know that the flu is more dangerous to our young kids. And again, I don't want to compare it to flu in the sense of a disease process, right? COVID is, as a disease, is horrible, and it's causing some strange syndromes. We're not quite where it's a very interesting new disease, and it's completely different than flu. It seems to be a real, primarily an inflammatory disease as opposed to an infectious disease. And so that's a good segue over to vitamin D, but it doesn't seem to impact the little ones. It doesn't seem to impact our young, healthy individuals. Of course, there's always going to be outliers. You don't know what's going on genetically with that person or what's happening on the inside. But it's primarily a disease of our elderly and our folks who are, I would say, in not terrific metabolic shape.
Well, that is my next question, which is explain the association that may appear to be between COVID-19 and metabolic syndrome.
Yeah, so and this is really linked to vitamin D. So vitamin D is a hormone that's stimulated through our melanocytes in our skin, and it's basically it controls how well our body responds from an immunologic perspective, or our immune system responds to diseases. And so the idea is that the higher our vitamin D levels, I would say the more robust our immune system is. But this is tricky because there are certain conditions that can bring down one's vitamin D. And what's not clear is that I just take a bunch of vitamin D. Does that can I assume that I'm in the clear? And I don't know the answer to that. Because one of the things we know when we say metabolic syndrome, so the idea of what kind of to break it down, metabolic syndrome is really this idea where it's a disease process where the body starts changing through, in my opinion, primarily through diet, but genetics do play a role. really where our body starts collecting more fat, and very specifically around our organs. We call that organ fat or visceral fat. And when that happens, something really changes with our hormones in our body, specifically insulin, and there's another hormone called leptin, and there's an imbalance that's created during this process. And in my opinion, sugar is the root of all evil from a metabolic perspective.
It's the devil's dandruff.
It's just absolutely, it's right up there with tobacco. And gosh, I might even be so bold as to say it's worse. It's as far as what a killer it is.
Right.
And so this environment is created, and what happens is low vitamin D levels can actually serve as a proxy, meaning that if someone says, "Gosh, do I have metabolic disease?" They may have a few extra inches than they used to have when they were in high school or college, and maybe they have a little bit of an extra high blood pressure. But when these, maybe their blood sugar is a little bit off, and they're like, "Gosh, am I really in bad shape?" So what's interesting is you can actually check a vitamin D level on a person, and people can actually order their own vitamin D at home, ship it to their house, and test their own vitamin D level.
Oh.
There's a company called Everlywell, which will send you a kit pretty cheap, and you can kind of get an idea. So if somebody has a lot of extra fat, visceral fat, organ fat, that fat tissue will actually suck up all the excess D in the system and basically hoard it. And so that D can't do its thing in the body and help to boost our immune system. So that's why those who have just excess weight, I don't want to say weight, because someone can be very muscular and have an abnormal BMI. Those that have a high percentage of visceral or organ body fat tend to bind D and really suppress their immune system. So what was fascinating was when we were seeing the first cases of COVID, and when I would hear about it, I would think, gosh, I visualized myself being on a ventilator, being in the hospital, being sick, and it was tough for me to really wrap my head around, like, gosh, this could really kill anybody. I'm scared.
Sure.
And then as the information came out, it's like, there's just a high propensity of people who are succumbing to this, who have metabolic issues, they're elderly, and more and more data is coming out that says, wow, these folks who are succumbing are actually in pretty rough shape. Of course, understanding there's going to be outliers of the young healthies who are impacted. And then the vitamin D associations started coming out, and we have to be really careful about associations, because associations do not prove causality.
Right. It's not the scientific method that we're supposed to use for these kinds of questions.
Absolutely not. So just because something has an association, but I think sometimes we can say, we can have a curiosity about something. And probably in mid-April, a lot of these vitamin D associations started coming out, and there was even one study that showed that 100% of the patients, and I don't know the cohort, I don't know the sample size, but there was 100% of ICU patients who were vitamin D deficient. And I'm thinking, gosh, that is pretty darn powerful, that 100% of folks in the ICU, either on ventilators or at least very ill, all had vitamin D deficiency. And I think we can even look across the country and even across the world of where are we seeing the cases. And I realize we can't really look at Africa too hard because of testing limitations. But we can look at Florida. I live in Florida. And again, knowing we didn't do anything terrific here as far as, social distancing, and lockdowns were late.
Right.
Yeah, definitely behind. But one of the things we have our proportion of elderly folks as well. But one thing we do have is we have the right latitude, not attitude, latitude. And we have, which means that perhaps we have a higher level of vitamin D in the system. Of course, there's other factors there as well. There's not as much density here, especially in Tampa. We do not have a robust public transportation system, which could facilitate the spread. But also looking at other countries, and it'll be interesting to look at countries like New Zealand and Australia, which we thought had fared very well, very few deaths. And then we kind of see what Brazil's going through as these Southern Hemisphere countries are going through coming into their winter. My hunch is they're going to experience a spike in cases as well.
You're talking about Brazil?
Well, Brazil's already experiencing theirs for sure.
Right.
And then it'll be interesting to see what happens in Australia and in New Zealand as they're coming into winter.
Now, what about the data comparing the United States to, say, Sweden?
So Sweden didn't really adopt too much of a strict lockdown, although I think the Swedes were, and even in the U.S., even before someone said to kind of stay away from each other, I know I was really doing that. I was like, I don't really want to be in the room, too close to folks and things like that. So it's so interesting when you kind of figure someone might have a disease, social distancing really sort of takes over. It's almost instinctual, at least it was for me. So Sweden didn't really adopt any strict measures. We know Japan didn't adopt too many strict measures either. And Sweden did fair, they feel like they did fairly well. And we look at deaths per million, and I don't have the data in front of me, but kind of middle of the pack. And I think Sweden admittedly felt like they did not do a good enough job protecting their elderly homes or nursing homes. And there was also a large minority population in Sweden, I believe Somali, who were disproportionately impacted. And that sort of fed into the little bit of the vitamin D comparison or contribution. So it really, the more bronze or dark your skin, the more difficult it is to absorb vitamin D. For example, Ted, you're
right.
Fair skin, yeah. So you could be out in the sun at high noon for 15 minutes and accumulate 5,000 to 10,000 units of vitamin D through that limited exposure. And someone with a darker skin profile, they would need to be out in the sun 2 to 3 hours to achieve the same level.
The worst sunburn I ever got in Florida occurred in 20 minutes.
Oh my God.
Oh my
God. Think about all the
Ooh.
vitamin D you generate.
Oh, right. Right. If you could get past all the blisters,
You'd rather take a pill for sure.
I think so. Yeah. And since we spoke last, my vitamin D is on the way. I mean, here's the thing.
Excellent.
There's no downside to taking vitamin D. There's other good reasons to take it. And if it happens to have a positive impact on my potential exposure to this disease, then all the better.
Oh, 100%. And gosh, just even thinking about you think about a World Health perspective, if we came out of this and said, man, there's so many lessons, I think, from this. I think, speaking about Sweden and the U.S., I think, and even Britain, I'd say the U.S. was hit very hard and Britain was hit very hard. And I'm, in my practice, I'm very metabolically minded, and I love looking at blood work. And if the blood work is hinting at metabolic disease, and metabolic disease, captures diabetes, heart disease, high blood pressure, belly fat, aches and pains, Alzheimer's. These are all I consider metabolic diseases. Even autoimmune diseases are thrown in here as well. And if we can just reverse all of these diseases with this diet and dropping the sugar and the soft drinks and the processed foods and just eat real food, then we feel like, oh gosh, I just dropped 20 pounds without trying. I actually feel like exercising now because I'm not carrying around 20, 30 pounds of extra tissue. So I've been very metabolically driven in my practice because it's wonderful to see patients thrive, and it makes me feel terrific to feel like, gosh, I'm impactful in their journey. And for me, the wake up call for us is just as a country, we're not leading the world in metabolic health. The numbers are 66%, I think, that is quoted these days, that our citizens are overweight or obese. And I think that is also the case in the UK as well. So when I look at it and I say, gosh, the U.S. did X, Y, and Z wrong and things like that, I look at it a little bit different. I say, gosh, we could have done better had we been in a little bit better metabolic shape. And so I think and it's very empowering for me to hear that as well, because I was really scared when the virus came in, and I was thinking, gosh, this thing can just take me. I mean, for me, not feeling in control or not feeling empowered is really challenging for me. I have a lot of fear if I don't feel empowered. And then when I felt like, no, I can keep my body in good shape, and if this virus comes calling, I'm gonna do okay. Right. And I think if we could, share that message that says, hey, if there is a second wave, or this bug is with us for, years to come, as some doctors are predicting, then, how do we get out of the fear, and how do we get from empowered, like, oh, this is no big deal. Kind of like how we view flu. Flu really comes calling every year, and it takes a good portion of us, but I would say the majority of us are not paralyzed by the thought of getting the flu. And perhaps it's because we have a vaccine. I think that does play a role, but I think in the case of COVID, if it does pan out that this is really COVID preys on those who are metabolically challenged, and we can reverse that. Oh my gosh, that's fantastic. There's nothing more empowering than feeling like, hey, I can get my body into shape, boost my vitamin D levels, lose this fat, and I'm going to do darn well with this virus if it comes into my house.
Well, I know several years ago, I came in for my annual physical, and you were very complimentary that I had shared with you that I was eating higher protein, higher fat, lower carb. But you found out that when I had my breakfast every morning of 2 eggs, I also had an English muffin. And you just told me, Ted, lose the toast, man. Lose the toast. You don't need that. And so around the same time, I happened to catch a film called That Sugar Film, and it was by a physician in, I believe, Australia. And he ate the average amount of sugar that a teenager consumed and did that for 30 days. And it almost killed him. Just crazy. And so I started watching, just didn't tell her that I was watching her, but when my daughter was at that point, I think about 8 or 9, and we started looking at what she was eating, and the amount of sugar she was consuming was just overwhelming. I was literally embarrassed when I realized. And so we slowly started weaning her off of that. And now she's a sausage and egg kid for breakfast. That's all she wants. She doesn't want any, sugar or pancakes or anything like that.
Oh, good for her.
Yeah, she's doing well. And that's all attributable to you. So I do appreciate that.
My pleasure.
Yeah. Well, so it is, this comes back to diet. It comes back to exercise, or you promote a ketogenic diet, don't you?
I do. And really, I guess I'll expand upon that. I propose any diet that gets us the results that we're looking for. And again, I challenge myself, my patients. I say, hey, look, let's get that waistline back down to where you were when you were in, college, the military. Let's get that muscle mass up, and let's lose that fat. And I don't care if it's a all licorice diet, if you can accomplish all of those things, which is, let's get the blood work looking fantastic, because the blood work tells us so much, right? And so I look at a broad panel of items I think are really important to give me a whole picture, well beyond a cholesterol, panel and waistline. And we got to track that muscle mass. If we're not strong, and we're not supporting our frame, there's just going to be breakdown. So it's really 3 things I'm looking for. you got to look good on the inside from a blood work perspective. We got to decrease that inflammatory visceral fat, and we have to be strong. And so that's, again, and I think ketogenic diet is a tool that can be used to get there. And I'll maintain that if somebody has a spike in their LDL cholesterol because they're having some eggs for breakfast, as long as their ratios look fantastic and their inflammation is low and the insulin is low and their waistline is pristine, and I think they're going to fare a heck of a lot better than someone with, a very low LDL, but with 5 extra inches and being pre-diabetic.
I understand.
It's how what I see with my patients. I have a nice flock of patients that let me, I don't want to use the word experiment on them, but
you can experiment on me. That's okay.
Well, we have,
yeah.
It's truly it's something where it's very collaborative. We say, hey, let's try this and let's see how the numbers look, in a few months. And so it's when things aren't working out, we come up with something different. And I think that's a little bit different how I used to practice. I used to give advice and I'd say, yeah, do this. And then someone come back and said, I did what you told me and nothing happened. And I would say, gosh, that can't be my fault because my advice is the best. It must be the patient's fault. And I realized, maybe, this is an individual. I need to treat them like an individual. Let's really get down to what works for them.
Sure.
And so,
sure. Before we move to talk about personal protection equipment, I do want to ask you about children and COVID. So many people, and I'm one of them, and you as well, have young children that'll be starting back to school in August. What is your comfort level at this stage with that happening?
Well, it's getting more and more. The data coming out. This is not a virus that, again, the data shows that the flu is far more dangerous to kids than COVID. And we do have some countries that have not stopped that primary school. Sweden is one. I think there's a couple of others who resumed school in mid-April. And the nice thing is I think we'll have that data coming back. I personally have a 9-year-old and a 6-year-old, and I never really had a fear for them throughout this because even back when this was raging in Wuhan, the data was not very powerful that this was impacting kids. And had it been that, I would have been just a wreck for sure.
Well, one of the reasons I think some people are concerned about it as well is the idea that so many other diseases are spread from children to adults. Is that how COVID reacts, or is it different?
It seems to be different. It seems that it happened in our household in December. Our 9-year-old was diagnosed and hospitalized with mycoplasma, which is a form of pneumonia. They call it walking pneumonia. And then it spread to my 6-year-old, who wasn't hospitalized, but had the highest fever I had ever seen, even as a physician. And then it spread to my wife. And so you're right, that's a typical pattern for sure. But it doesn't seem to be the case here. It seems to be really the opposite, where the adults are spreading it to the little ones.
Got it.
But again, this is all going to be, again, looking back, hindsight's 2020, and I think we look back upon this and say, gosh, what can we learn? What did we do right? What did we do wrong? What can we do better next time? And then I think each of us looking personally and saying, yeah, there is this strong component here with this from this metabolic perspective. Let's see what strides I can make, and almost losing the pounds like our lives depend on it, because it truly could be the case.
Maybe it does. Maybe it very much
correct.
Does.
Maybe. And even if it doesn't, gosh, think of all the other benefits.
Sure.
Just so truly, what do we have to lose?
Yeah, but I'm going broke buying new jeans. Like absolutely none of my clothes fit. And if anybody wants a whole closet full of size 40 regular suits, just give me a call. You can have them. But it's again, you've really kept me on the keto path, and I think it's been the best. I hope that you enjoyed the opportunity to listen to Dr. Griffin answering some of these questions. And I want to go back and key in on a few things that he said. He talked about the fact that doctors are, obviously advising people to maintain social distancing and to use personal protection equipment. But when it comes to children, the general belief, according to Dr. Griffin, is the data is actually suggesting that the children are not getting it from other children. They're actually getting it from other individual parents. Adults are giving it to children. The other thing that I thought is very important for him to mention is that it appears that a significant number of the people who have died from COVID-19 suffered from various metabolic conditions, things like cardiovascular disease, fatty liver disease, talking to people about having diabetes. And the idea being that the areas of the body that are suffering from inflammation from these metabolic conditions make individuals especially susceptible to the disease and for the fatality associated with that. But as you heard him say many, many times, we have to watch the data. What is the data telling us? And at this point, we're still in the process of gathering that data. He did indicate, as you recall, that he believes it is safe to return our children in August. And I will tell you that I believe that schools should do what they can to honor the boundaries of the parents, whether they're comfortable in bringing their child back immediately or whether or not they're going to wait for some period of time before they expose their children back to a public school environment. We're just going to have to see. But it certainly, for me personally, when I was able to speak with Dr. Griffin a few weeks ago, and now we've spoken several times, he's given me an enormous amount of comfort, and I hope after listening to the podcast, you have some comfort too. In the meantime, I need you to keep an eye out for us, and we have another video audio coming from Dr. Griffin that's going to specifically address the safety and efficacy of personal protection equipment. He's going to answer questions like, are N95 masks safe to use? Are there people who shouldn't be using them? And if they are using them, how can they limit any of the consequences of associating such a high concentration of carbon dioxide? And so we'll look forward to sharing that podcast with you as well. The easiest way for you to gain access to that is to subscribe either to our Spotify account. We have our content being published here in the context of getting the content through iTunes as well, using our News Munchies platform, which is the other brand that our podcasts are published. But to me, it seemed as though we needed to use the broadest spectrum of exposure as we could because of the importance and the timeliness of the content. I want you to keep an eye out for my hashtags, hashtag mask mission. I want you to keep an eye out for hashtag Corliss Cares, because I do. And I want you to keep an eye out for additional information that'll be coming out about the data that's coming in over the summer, and we'll share the decisions with you that we're making for ourselves and for our family. We look forward to you joining us on our website at www.corlissbarfield.com or www.newsmunchies.com, which is our cannabis brand. Again, my name is Ted Corliss. Be well.